Older people in England's most deprived areas are twice as likely to lack the help they need for basic acts, like using the toilet or taking medicine, compared with those in the richest neighbourhoods, according to figures that expose gross inequalities in access to social care. The official analysis is another sign that years of cuts have damaged the ability of councils in poor areas to meet the growing demand for care, potentially putting significant pressure on the NHS. It comes on the back of the crisis over social care that is still unresolved. There have been a series of warnings about a multi-billion-pound funding black hole and increasingly severe consequences for the health service. A third of men aged 65 and over in the most deprived areas, 33%, have an unmet need for at least one so-called activity of daily living, such as washing their face and hands or getting out of bed. In the least deprived areas the figure falls to 15%. Meanwhile, 42% of women over 65 in the most deprived areas have an unmet need for at least one such activity, compared with 22% of their counterparts in the richest areas. The inequalities were exposed in the latest data from the official health survey for England. It used information on income, employment, education, health, crime, housing and living environment to find the most and least deprived neighbourhoods. Local authorities with the highest proportion of deprived neighbourhoods are in Middlesbrough, Knowsley, Hull, Liverpool and Manchester. A series of factors have led to poor areas finding themselves at the sharp end of the care crisis. Demand for help is higher in more deprived areas, while the councils catering for them have suffered the most from central government cuts and are the least able to raise extra funds. The knock-on effects for the NHS see elderly patients end up in hospital unnecessarily after accidents at home, while they cannot be discharged unless they have adequate community care in place. Among men, 30% in the poorest third of households needed help with an activity of daily living, ADL, compared with 14% in the highest income group. Among women, the need for such help was 30% among the poorest third and 20% in the highest third. There is a growing army of unpaid helpers, such as family and friends, propping up the system. Around two-thirds of adults aged 65 and over, who had received help for daily activities in the past month, had only received this from unpaid helpers, the figures revealed. Spending on adult social care by local authorities fell from £18.4 billion in 2009 to 10 J Unit Street under £17 billion in 2015-16, according to the respected King's Fund. It represents a real terms cut of 8%. It estimates there will be an estimated social care funding gap of £2.1 billion by 2019-20. While an extra £2 billion was provided for social care over 2 years, a huge gap remains after the latest budget failed to address the issue. Theresa May was forced to abandon plans to ask the elderly to help pay for social care through the value of their homes, after it was blamed for contributing to her disastrous election result. The government has promised to bring forward some new proposals by the summer, but many Tory MPs and Conservative-run councils are desperate for faster action.